Okay, question one. Factors which affect health in Nigeria include all except
Marital factors.
marital factors. Correct. PHC is an essential healthcare because
It provides the basic needs of the people.
basic health needs. It provides the basic health needs of the people. Environmental factors influencing the health. Environmental factors negatively affecting the health of the community include the following, except
Potable water supply.
potable water supply. Potable water supply is actually a positive thing. The three tiers of healthcare delivery in Nigeria include
Primary, secondary,
and tertiary.
primary, secondary, and tertiary. The characteristics of tertiary healthcare include all except one.
close to the grassroots.
WHO definition of health include but one. Okay, correct. B. PHC focuses on, the answer is C, universal provision of health services based on needs. In WHO definition of health, three aspects of health are identified.
Mental and social.
Yeah, physical, mental, and social. That's option D. Physical, mental, and social. You're right. Bye-bye. Primary education in hospitals and clinic setting linked to following treatment procedures, medication, home care, and rehabilitation procedures is termed
Patient education.
correct. Patient education. That's the patient education. They do this a lot in primary health. The main goal of health education is
Acquire positive change in health attitude and behavior.
correct. D. Acquire positive change in health attitude and behavior. Question 11. All are settings for health education except, what's your answer? Political rallies, of course, because target for health education exclude health educators because they are already educated. Ability to make and maintain acceptable interactions with other people explains.
Social health.
Correct. Social health. B. Social health. B. Health education is aimed at discouraging the following harmful traditional practices except. The answer is prolonged breastfeeding. Because prolonged breastfeeding is actually good now. You cannot discourage prolonged breastfeeding. Because prolonged breastfeeding is good. There is no harm in prolonged breastfeeding. At least health educators encourage that you breastfeed for maybe 6 months at least. None of the following is not a component of good communication. Radio, correct. Effective communication is facilitated by
Adequate feedback.
correct. A. Adequate feedback. Question 17. Let me take you to the next page. The following are traditional practices that are considered beneficial to health, except female genital mutilation. That's the answer. Female genital mutilation is also the same thing as female circumcision. It, yeah, people should stop circumcising female. That is, it's the removal of the skin that covers the clitoris. Okay, removal of the skin that covers clitoris. Traditionally, they said it will stop a girl from being promiscuous. Okay, because the sensitivity to sexual stimuli will reduce. But now, health educators are advising against it, that you should not circumcise females again, that it causes more of a health problem than good thing. Okay. The following are key elements of communication, except
Channel.
no, you need the channel, is provider. You need the channel of communication. You need a good channel of communication. Two important methods of communication are
Verbal and no verbal.
correct, B, verbal and non-verbal. All of the following are structures of the female reproductive organs, except
Penis.
penis. Penis, correct. Nursing school poop, you can answer it. Which of the following is correct of PhD?
A.
Correct. A. It is a grassroots management approach to providing healthcare services to the community. Correct. Reasons for first aid include the following, except
C.
correct. C. Increased mortality rate, because mortality means death. So first aid will not increase death. So that's the answer. Emergency conditions include the following, except emergency conditions include the following, except
Headache.
Headache.
correct. Headache. ABC management of emergency conditions covers
A.
is A, airway, breathing, and circulation. If there's an emergency, you must be sure that the airway of the person is clear. Then you must be sure that the person is breathing, and you must ensure circulation. Shock may result from the following, except shock may result from the following, except
Blindness.
blindness. Yeah, blindness. An immediate and temporary care given to a victim of an accident or sudden illness before the services of the physician is called
First aid.
first aid, correct? Which of the following is not advisable when you are applying bleeding control? Which of the following is not advisable when you are applying bleeding control? Pouring lukewarm water to the site of bleeding. There is nothing this one want to do. You're just wasting your time. So that's the answer, D. Which of the following can be used to extract tooth? This is to remove tooth. What you use is forceps. Forceps. Okay. So which of the following is not an oral disease? Which of the following is not an oral disease?
D.
The peritonitis is correct. The peritoneum is located where? It's located
Abdominal. Abdominal cavity.
yeah, abdominal cavity. Which of the following is a risk factor of oral cancer?
Tobacco use.
In fact, smoking is a risk factor of almost all the cancers. As a first aider, you are an eyewitness to an accident case. Which one of the following is wrong?
C. C.
Yeah, C. You have to attend to the unconscious first before the conscious. And don't panic, maintain your steez. Yeah? So, cardiopulmonary resuscitation is an example of cardiopulmonary resuscitation is an example of
Cardiac disease.
life-saving procedures. So 33, which of the following is not art related? Which of the following is not art related?
Asphyxia.
Yeah, asphyxia is about the respiratory system and it describes the lack of oxygen. Okay, that's what asphyxia is all about, lack of oxygen. Following is not part of the objectives of family planning counseling. Information about family planning to clients. This word ambiguous means something that is not clear. You know, I used to use it a lot. If I say a question that is not really, I'll say this question is ambiguous. So it means it is not clear. You cannot decode what the person is saying. Okay, so that's the answer. 35. The provider of counseling on family planning and child spacing methods should,
Accommodating.
yeah, be friendly and accommodating, correct? One of the following prevents unwanted pregnancy and STDs.
Condom.
Correct, condom. A burn as a result of moist heat is called burn as a result of moist heat is called. You have done this before.
Scarred.
How?
Sad.
I wanted to say we have and hyperglycemia as signs and symptoms of
Diabetes.
Diabetes mellitus.
diabetes mellitus, correct? All these are side effects of hormonal contraceptives, except all these are side. Yeah, syncope. Syncope actually means that somebody fainted. That's what syncope means. It's synonymous to fainting. And when you take oral contraceptive, you don't faint now, do you? The primary health care is essentially aimed at all the following, but it's
Intensive care.
yeah, intensive care is for the tertiary health care. If they say someone is in the ICU, intensive care unit, the person is probably on life support, and you know that they don't have that kind of facility in the primary health care. Okay, one of this is not a relation of the uterus. One of this is not what?
Nipple.
Yeah, the nipple. The nipple is not in relation to the uterus. 42. Let me take it to the external genitalia is made up of this following: vagina. Vagina is part of the internal genitalia. You know that the whole thing you see in a woman, the whole thing you can see in a woman's reproductive private part is what people call vagina, but that's not the vagina. The vagina is almost the first part of the internal genitalia, and that's the part that has what kind of epithelium. I've talked about this. What kind of epithelium is in the vagina?
Stratified squamous epithelium.
Stratified squamous epithelium. So that part is inside. You cannot see any stratified squamous epithelium outside now. So the vagina is inside. Okay. The vestibule is where the vestibule is where you can find all of the following: the clitoris, the urethra orifice, UO, then the vagina orifice. This is where that's the vestibule. Vestibule is like that space between the labia minora. That space is called vestibule. While urethral orifice is where the urine comes out from. This one is straightforward. Then perineum. The perineum is the space between the vaginal opening and the anus. Okay, so the space between the vaginal opening and the anus is called the perineum. All right, I hope you got that. Which of the following is a highly sensitive organ in the female?
Clitoris.
Yeah, the clitoris is a highly sensitive organ in the female. The main objective of first aid is to main objective of first
Save
aid
life.
is to save life. To save life. ASH is an emergency care for a victim of sudden illness or injury until more skillful medical treatment is available. DASH is an emergency care for a victim of sudden illness or injury until more skillful treatment is available. What's the answer?
First aid.
Yeah, first aid. They really like first aid in PHU. Okay, so let's move. Let me go to the next. Whenever a case of dog bite is brought before you, always remember PIA stand for PIA stand for no. It protects, immunized, available. Although the grammar seems somehow, but dash is unconsciousness resulting from oxygen deprivation and systemic accumulation of carbon dioxide.
Asphyxia.
Asphyxia, correct. Asphyxia. Okay. Allergic reaction from drugs is an example of which type of shock?
Anaphylactic shock.
Anaphylactic shock. Correct. Anaphylactic shock. Heart failure in the case of acute heart attack is an example of what type of shock?
Cardiogenic.
Correct. Cardiogenic shock. Question 50. Let me put it next. In type of shock, reduction of energy is an example of in a type of shock.
Hypovolemic shock.
Correct. Hypovolemic shock. Question 51. The following listed below are examples of content of standard first aid box, except RDT, correct. RDT means rapid diagnostic test. So that is usually not included. What is the full meaning of CPR?
Cardiopulmonary resuscitation.
Correct. Cardiopulmonary resuscitation. If someone has stopped breathing, the brain will soon be deprived of oxygen. Oxygen. Dash are thermal wounds caused by dry heat. Burns, correct. Which of the following degrees of cover the whole of the skin? third degree burn. Third degree burn. Dash is said to occur when there is a break in the continuity of the bone. Dash is said to occur when fracture, correct? Fracture. In a situation whereby the bone is broken, but the ends of the bones do not tear, meaning come out. That is the skin remain intact. The fracture is called simple. It's a simple. Uh, Dash is a type of fracture in which the fragment is depressed below its normal level. It's
Compound.
no, depressed fracture. A depressed fracture involves a bone fragment being pushed inward. The important factor that determines the seriousness of a burn or scarred is the degree
Of bones unscarred.
of burn or scar. The escape of blood from the vessel may be either external or internal. It's called
Hemorrhage.
hemorrhage. Correct. Hemorrhage. One of these diseases is associated with dog bites.
Rabies.
Yeah, correct. Rabies. Condition that could cause a person to epistaxis, nose bleeding, include all except
Alcohol intake.
alcohol intake. Correct. Alcohol intake. Cause of its abdomen include all except, let's say, abdominal.
Stroke.
Exactly. Stroke. The following are life-saving conditions except
Accident.
accident. Correct. The following are common emergency conditions except
Arthritis.
arthritis. Correct. Deficiency of vitamin D causes
Rickets.
Rickets.
rickets. Correct. The best therapy for obesity is
Diet therapy.
diet therapy. Those of you, DASH is a disease in which the patient does not suffer a complete disorder of the mind and behavior. Neurosis. Neurosis. Neurosis, it involves an emotional distress without severe disorder or behavior disruption. All these are neurosis. That's the answer. Do you know why we are picking neurosis? The reason is because if you take a look at this, delirium, paranoia, hallucination, all these ones, you are breaking away from reality. Okay. Like in the case of hallucination, the person is hearing voices that are not there. The person is seeing people that are not there. In paranoia, this one, in this, if they say somebody is paranoid, you might be thinking your innocent mother is doing you. That's what we call being paranoid. So if you hear somebody say, "Don't be paranoid," it means don't be far from reality. Okay. So that's what it means. So in all these other conditions, the patient is far from reality. Yeah, paranoia. The person is far from reality. But in neurosis is just an emotional distress. The following are factors that affect mental health, except
Position in the society.
correct position in the society. All these are characteristics of a person with good mental health, except all these are characteristics of a person with good mental health, except
Difficult adaptation.
difficult adaptation, correct. 72. Which of the following is an example of dental diseases?
Dental caries.
Dental caries. All these other ones look like, I don't know what they mean, but they look like jargon. Which of the following preventive and control measures can remove plaque totally?
A.
Flossing, correct. Flossing. Dash, let me take it to the next page. Dash is a risk to dental caries. Dash is a risk factor to dental caries.
Poor oral hygiene.
Correct. Poor oral hygiene. Osteoporosis is common among one of the following age groups.
Chandra.
No, age, the aged. 76. Preventive care and health maintenance for the aged include toilet.
Sedentary lifestyle.
Sedentary lifestyle. Apart of the network is bad, but I guess you were trying to say sedentary lifestyle. Adequate recreational activities and entertainment should be provided for the aged to prevent one of the following.
Diabetes.
For recreational activities and entertainment is to prevent boredom now, so that they won't be bored. Is to prevent boredom, not entertainment is to prevent boredom. According to WHO, elderly are those
60 years
Age
and above.
60 years and above. Correct. One of the components of primary health care that focuses on taming common ill health in the community is I think this should be immunization.
Yes.
So immunization. That is a state of being free from mouth and facial pain, oral and throat cancer, tooth loss, and other diseases and disorders that limit an individual's capacity in speaking and psychosocial well-being.
All
All
right.
right.
Alright.
Very straightforward. It's oral health. Okay. The principles of health education include all except
Ambiguity.
ambiguity.
B.
I've explained this before. I told you that it means that something is not clear. Okay, so it's ambiguity. Which of the following, oh, let me take you to the next page. Which of the following examinations may be excluded from the regular medical examination?
Genotype.
Genotype, because me have not seen. Social services for the aged include all except
Excursion.
excursion. Which of this is not an open wound? Contusion. Okay. The contusion is a closed wound, while lacerations, abrasions, and incised wounds are open wounds. The first set of teeth that start to grow around 6 months of the baby is incisors. Incisor, correct. Incisor. Dash is used for chewing and grinding.
Premolar.
Premolar, correct. Premolar. The following are diseases associated with the oral cavity except no.
Toothache.
Toothache, yeah. Toothache is a
Toothache.
symptom. Is a symptom, not a disease. If you have toothache, something must be the cause. It could be dental caries, it could be tooth abrasion, it could be periodontal. So toothache is a symptom. Just like headache. Headache sometimes is a symptom. There must be an underlying cause. Common places where accidents occur include these, except
Wound.
wound is not a place. Wound is not a place. Abdominal pain relieved by ingestion of antacid is a strong suggestion for
Peptic ulcer.
correct peptic ulcer. All these are rational situation analysis in primary health care, except B, not to identify the distribution of health in the community. B. These are types of healthy behaviors, except
Smoking.
smoking. Correct. All the following are challenges faced by PhD in Nigeria, except
Adequate funding.
adequate funding. The major role of secondary healthcare facilities include no, is management of chronic disease. Let me take this to the next level, to the next line rather. PhD approach of the Nigeria health system emphasizes all this, but
Lack of attentiveness.
lack of attentiveness is kind of negative. Lack of attentiveness is kind of negative. The following can be used for outreach service, except
Ectopic pregnancy.
ectopic
Pregnancy.
pregnancy is an emergency situation. It cannot be said. A continuous assessment of PhD activities to ensure it achieves the desired goals is known as monitoring. 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 Principle of health education include all but
Personality.
personality, correct? Personality. Which of the following is not a factor that influence our health?
Hard work.
Hard work, correct. Leading cause of maternal mortality in Nigeria includes all of the following except
Sepsis.
Sepsis.
all are principles of PHC except
Management of cancer.
management of cancer. Yeah, correct. This brings us to the end of today's of PHC 2023. Okay.
Thank you, sir.